Do you have problems understanding epilepsy or maybe describing seizure types or using the International League Against Epilepsy framework? Then don't worry, welcome to our epilepsy courses. We have prepared 3 courses about epilepsy, which are very easy to understand and very practical. The first course is about classification and terminology. The second course is about epilepsy treatment, and the third course is about epileptic syndromes and their treatment. In this first course, which is focused on classification and terminology, we have divided all the subjects in 4 sections. The first one is about the definition of epilepsy. In the second section, we will be studying the seizure types with many examples. In the third section, we will be focusing on neonatal seizures. And in the fourth section, we will be focusing on the framework and how to manage a patient and all the workup of a patient with epilepsy. So just a few examples. In the first section, we will be studying this definition with the easy to understand slides with graphs as you see here. We will also see many examples of real patients to see if we can apply and we know this definition. Then in the second section, we will be seeing the different type of seizures, the semiology, how to describe the seizures and do a good medical history. And also we will be studying all the subtypes of focal seizures with examples of what's the semiology of each lobe. We will also see EEGs because it's so important to have this tool to diagnose patients with epilepsy. As you see here, you will learn how to diagnose a patient with absence seizure with his typical 3 Hertz spike and wave, as you see in this slide. We will also focus on neonatal seizures, which sometimes are very difficult for students and fellows, and there are some particular things about the neonatal period. As you see in this graph, we will talk about all the etiologies and also the semiology of neonatal seizures. In the last section, we will talk about the framework and how to manage a patient with epilepsy, how to start studying the seizure types, the epilepsy types, then the epilepsy syndrome, and we will focus a bit on the etiology, talking a bit more in detail about genetics and metabolic causes of epilepsy. Well, thank you very much for your attention, and of course, thank you for choosing us.